patient experiences when how to know that yes, now I am having a jaw joint disease?
See, most commonest problem which a patient has is for any joint problems is pain. For example, to say this is the joint which is called as a temporomandibular joint. When the patient has temporomandibular joint disorders, most commonly what he feels is pain, especially the pain aggravates when he tries to open his jaw or close his jaw. The other things which we come across is the clicking sound. Whenever the patient tries to open his jaw or close his jaw, there will be a clicking sound which will be heard, and deviation of the jaws. Apart from the jaw joints only, there will be some amount of musculatures which is being attached to these joints, and any tenderness or pain associated with these muscles are also indirectly relating that there is some problem with the joint.
So, what all are the treatment options available for treating such disorders? Is surgery the only option?
No, surgery is not the only option. It depends upon the condition, the severity, and the amount of changes it has been, the jaw joint has been underwent. So basics, it's just as jaw rest, anti-inflammatories, occlusal guards. These will be sufficing if there is very minor initial stages. As it has reached into an advanced stages, yes, it requires arthrosynthesis, arthroscopies if it is required, and last resort is only the temporomandibular joint replacement.
In a country like India, which is like in a developing country, oral cancers are very much prevalent. Please share some knowledge on head and neck cancers and head oral cancers.
See, amount of head and neck cancers or the oral cancers which we see in India is the most, or in Southeast Asia has the more. That is because of the habits, like especially tobacco and tobacco related products which we use in South Asia. I don't think so anywhere else in the world it is so commonly used. Most of the oral cavity cancers or head and neck cancers are related to these byproducts, at least in India as of now. How these present to us, like oral cancers, these present as a non-healing ulcers, pain or swellings or ulcerations with proliferative growths into the oral cavity or into the facial regions with some amount of lymphadenopathies or mobile swellings in the neck. This is how these people present to us. But once they are presented, then we evaluate. If it is required, we do a biopsy and further necessary investigations such as CT or MRI radiologically. Based on this, we stage the disease into which disease. Based on the staging, then we recommend what type of intervention it is required. Most commonly, oral cavity cancers are treated with surgery followed by radiation or chemotherapy if it is required.
So the defect which is caused by surgery, like in these head and neck cancer patients, are do we have any reconstructive options also to bring the tissue back into form and function?
Whenever we try to operate any type of these type of surgeries or these type of treatments, our main aim will be of two things. One, to make sure that the patient, we are adding up life to patient's years, whatever time he is there, and the second thing is to make sure that the patient get back to his normal as early as possible and as complete as possible. What all we aim is, first thing, we aim to make sure that his functions has been restored. Function, for example, to say for oral cavity cancer, what all functions we aim to is make sure that he is able to chew his food properly, he is able to open his mouth properly, he is able to phonate or speak well, he is able to have a good lip competence. The second priority will be our facial aesthetics, and again, both matching these two will be always a challenge.
In today's scenario, everybody is more aware about aesthetics. So, how aesthetics can be corrected using maxillofacial surgeries? Like, what all options we have in surgery?
You would have all come across like braces or clips, which they commonly say as for dental, for generally teeth corrections. So initially the era was where there was only an orthodontic treatment. Now again we have moved out of it. For everything there is a limitation. Or even for teeth corrections there is limitations beyond which there cannot be corrected or they cannot be aligned. So in those type of things there is something called as orthognathic surgeries, wherein with the help of an orthodontist we try to improve the facial outcomes by doing surgeries onto the maxillary and mandibular jaws, which is required.
Sir, there's one most common problem of snoring. Like everybody, one or other person in our home, he snores. nowadays what all options have come into our knowledge about these to treat such snoring cases?
See, again, snoring, what we call as obstructive sleep apneas. So, snoring is a common problem, but more than snoring, what we'll be addressing is there any obstruction which has been leading to these type of snorings. So, we have to identify what is the cause for snoring, especially which happens during the sleep cycle, and whether is there any hypoxia associated with these snoring cycles. So if it is there, then we try to evaluate what is the cause for it. So if there is an obstruction may be ranging from the nasal cavity to the hypopharynx. So we have to identify where exactly is the obstruction is there. There are surgically treatable causes. If those have been identified, then we treat with surgeries. Surgeries most commonly involves like nasal septoplasties or 𝗕𝗵𝗶𝗫s, what we call as 𝗕𝗵𝗶𝗫𝗫 associated, and then submental hyoid surgeries, what we call, and along with that, if there is any jaw discrepancies which is associated, yes, definitely correction of this maxillomandibular surgeries will help in treating this obstructive sleep apneas.
So till now you explained us about all the procedures, what are the disorders, what are the treatment procedures available. See, we have seen surgery has come a long way. If we see a scenario of a few decades back and today's scenario, so surgery has come a long way. What all new innovations you expect in future, and how surgery is advancing nowadays?
See, as you rightly mentioned, by what we used to hear or what our parents used to look into this specialty, and from there what it has been evolved is magnanimous. But yes, this is an evolving fraternity, and as all other subspecialties evolve, even maxillofacial fraternity will also evolve in future. Till the current scenario what we are, until what I expect in forthcoming years are the incoming of more amount of CAD/CAM, virtual plannings, virtual surgeries, robotic surgeries, endoscopic surgeries which are upcoming in, and there is so much of navigation surgeries which are involving, not only in cases of trauma, even in cases of implant placements also. And with the upcoming of tissue engineering and stem cells, there is more amount of potential for it. Even for a simple examples, nowadays you would have come across, after a simple tooth extractions also, they are putting something called as a PRF or PRPs into it. These are nothing but small sources of tissue engineering or stem cells transplantations only. So yes, there is so much of scope. Yes, and with the amount of technologies which are evolving as the days, there is much to be expected, and we also has to evolve with these all technologies.
Like other medical specialties, dental also has 8 to 9 specialties, and oral and maxillofacial surgery is one of that branch of the dental specialties. So now you all are aware that in what cases you need to seek super specialty care and super specialty approach. So thank you so much.